This business is not sponsored by or affiliated with the United States Department of Veterans Affairs or your state's Department of Military and Veterans Affairs or any other federally chartered veterans service organization. Other organizations, including but not limited to your state's Department of Military and Veterans Affairs, a local veteran service organization, and other federally chartered veteran service organizations provide this service free of charge. You may qualify for other veterans benefit services outside the scope of what this business offers. All disability claims for increased ratings are processed by the United States Department of Veterans Affairs. This business cannot expedite the processing of your claim by the United States Department of Veterans Affairs.
Hey, honey.
Hello, Coach Walter. How you doing, brother?
Good, brother. I'm doing well. Coach, happy to be doing this Facebook Live with you, and welcome fellow veterans to Facebook Live. Woo-hoo.
Yep. Thank you for coming. Actually, we appreciate the support. We appreciate you taking the time out of your busy day to just hang out with us and learn, which is what we do the best here at VA Claims Insider: teach, educate our veterans. So, welcome. Today's Wednesday, the last Wednesday of the month. This year's almost over. So,
yeah. Thank
you. I know. How you been, brother? How's everything up there in the Connecticut's?
Connecticut, it's cold. It's cold. I'm gonna tell you, it's cold. The hummingbirds have left, so have the leaves. They're working their way all the way down. So, yeah, man, it's cold. I'm looking forward to the snow. So, cold without snow is what's the point?
I know. Over here in Tampa, Florida, it's getting cool, especially in the evenings, which is nice. Still walking around in sandals all the time. So
yeah, well, I can wear shorts year round, but up here in Connecticut, it's beautiful, man. I tell you what, it's beautiful. They don't talk like me up here. Don't talk like me.
No, they don't.
Being from Virginia, but it's a cool spot. Dig it. Lots of veterans up here for sure. Lots of veterans.
Good. It's always good. And folks, once again, thank you for coming. Today we're going to be discussing one of a very common topic is musculoskeletal conditions, okay, which probably almost every veteran has, myself included, and Walter, I'm pretty sure you do have. Okay, yeah. So we're going to be doing this presentation shortly. We're just going to get everybody to settle in, get your beverage of choice, sit down, have notes, and hey, listen, let us know where you're tuning in from. Also, let us know which branch you served in, the time frame, what was your job, and if you are an elite member here with VA Claims Insider, let us know who your coach is. Give him or her a shout out. Okay.
Yep, give them those props.
Yeah, and once again, thank you for being here.
Yeah, it's going to be a good day. Going to be a good topic. Good topic. Yeah. Good conversation for sure.
Right of that. So, hey, what brought you here, Coach Walter? How did you end up here?
How did I end up here? Well, COVID is why I ended up here because my background. I'm an old Navy vet, P3s, VP sailor, and I ran the water survival program. That's really my claim to fame. But messed my shoulder up. Couldn't do my job anymore. Musculoskeletal, blew it out, and they could not fix it. So honorably discharged, disabled veteran for, 12 years. 12 years I was in. But did a lot of cool things. COVID hit. Couldn't really do the fitness industry anymore. Didn't care to do that. And VA Claims Insider popped up. Looked like something really cool to do. We started at the same time. I was a veteran ambassador when you started.
Right, that, yep.
And I did my time there, and then got honored to be a coach, educating everybody. Man, best job in the world. Doesn't feel like work every day. It's great. It's great.
It is.
So why are you here, Coach?
I'm here because just like a lot of our veterans, I started looking into the claims and looking at the VA Claims Insider videos, and one led to another thing, and I said, hey, I'm just going to go here and become a veteran, client. And then I went from 60 to 80, and then I got hired here. And then, the rest is history. You and I started, it'll be 3 years now in December. we're coming on our 3rd-year anniversary, brother. We see some people popping in already.
Yeah,
look
man,
at that.
coming in.
Yeah. Welcome everybody. Thank you. Thank you for being here. We're going to try to get to your questions towards the end. We're going to open it up to Q&As after the presentation. So if we do not get to you today during this 1-hour presentation, don't worry, come back. We're going to have somebody from our team go over and answer your question. Okay. So please just be patient. Okay. Just, deal with us a little bit, please. Okay. I see, Richard Green, aviation, this is Storm. Suffer from DED, the degenerate disc disease. Okay. I feel your pain, brother. The same here. Okay. I know what it is. Okay. We got some Jason Miyamoto, Navy from 1994 to 2004. 94, that's when I went in. He's one of your sailor brothers there.
That's when I got out. Because I'm old.
Yeah, so
lots of Navy. There's some Lizarde. I will mess that name up. Navy from San Diego. Great having you there.
Yep. We have Alan Stafford, Georgia Marines, Devil Dogs there. Okay. Troy Matt. It looks like he's going through some things with musculoskeletal. So this is a great presentation for you.
Oh yeah, well, he said the right things, right? He said he's just looking to try to getting everything diagnosed. Man, you got to get a diagnosis.
Mm-hmm. Yep. So
awesome.
All right, so we're gonna just to let you know, we're gonna be doing this presentation pretty soon. Okay. Just to let you know, this is we do this every Wednesday. Most of the Wednesdays we do this presentation. So it's because we want to give to the people, make sure that we out there, we understand the frustration. We want to make sure that our brothers and sisters navigate the VA process in a better, best understanding way. Okay. So yeah, Walter, you want to just take it about how we do this with the strategy, the education, and the medical evidence?
Oh yeah. So what we do is strategy, education, medical evidence. Medical evidence wins claims for sure. With our program, if you're in our program, you'll be assigned a coach, and they'll have a one-on-one strategy session with you. Look at your unique circumstances, your conditions, and once y'all have agreed on the strategy, then it would be a claim submission. And we do education. We educate you about the claim, get it ready to go. Once you file that claim, then you'll have the compensation and pension exam will be scheduled for you. And we get you educated on all that, because that is your most important day in the whole claims journey, getting that CMP exam right. And then we have our live classes, lots of live classes. Like I said, we do have our Facebook Live every Wednesday. We have up to 3 live classes a week. We have the coffee with the coaches. We do that Monday, Wednesday, and Friday. That's 8 a.m. to 9 a.m. Central Time. Great opportunity. The coaches are out there. Other veterans in the program are out there. Sometimes they have a topic. A lot of times they talk about compensation and pension exams and how to get through that. We also have our mental health exam education classes and the medical exam education classes. All this education classes get you ready, prepared, so that you know what your conditions are and how to explain them. And then if you're interested, we do have discovery calls. If you want to learn more, you can schedule a discovery call and talk to one of our team members by going to vaclaimsinsider.com and reach out to our organization at vaclaimsinsider.com. We'd love to partner with you in your VA claims journey. Get you going.
Yeah, if at the end of this presentation, you want to, if you're not in this program, you want to work with either Coach Walter or myself, throughout this presentation, our team is going to be putting our unique personal links for you to sign up with us, and we do this for a living because we really believe in this mission. So give us a chance. Let us help you so you can have a better life. To be honest, because we change lives here all the time. My life has been changed because of this company, and I'm not just exaggerating. Okay.
No, every day,
So,
right? Every day.
yep, it does. So, we're going to just start with this presentation, okay? Like we mentioned at the beginning, like y'all know, this is a reference the musculoskeletal conditions, okay? So, those are musculoskeletal conditions refer to a wide range of injuries and illnesses that affect the body's bones, the muscles, the tendons, and the ligaments. Common musculoskeletal conditions include sprains, strains, arthritis, fatigue, weakness, reduction in flexion in the arms, the neck, and the joints. Runners know their jobs intensely and how they are more likely to sustain injuries on the front lines. Therefore, it's not unheard that veterans to endure injuries of their shoulders, the back, the legs, the knees, and hips. Just like I have every single one of those. Okay, yeah, it doesn't help that I was artillery for for 14 years and airborne at the beginning of that too. So,
And you probably didn't go to the doctor.
oh, I did, but until I had to wait until it was really hurting, so I can show that I was in pain. But however, musculoskeletal conditions aren't always directly related to the injury while serving. In addition, some of the veterans may experience secondary injuries from their time in service. Okay, and this is very important. So there's different ways of submitting claims. Sometimes it's directly, and sometimes it's secondaries. Okay. So let's suppose you injured your arm while serving, okay, and that caused you more likely to put additional stress on the non-injured arm, overusing the other one, okay, and that's caused you long-term strain, potentially leading to a musculoskeletal condition like arthritis. Okay, common sample is you injure your knee, okay, in basic training or when you're in service, and then throughout the years, you've been changing your gait. Therefore, you've been favoring that leg and putting more strength on the other one. Now that one can be. That's what we're talking about.
Yeah.
Okay. Go ahead, Walter. Let's discuss some of the most common conditions.
Yeah, we'll talk about some of the musculoskeletal conditions that are rated by the VA. So the VA rates musculoskeletal conditions for disability compensation. These are just a few examples of some of the most common musculoskeletal disorders rated by the VA. So you have arthritis. It's just the general term used to describe the inflammation of the joints. There's a lot of different types of arthritis, including osteoarthritis, which is just degenerative, and then the rheumatoid arthritis, which is a swelling and tenderness of the joints. So the VA rates arthritis based on the range of motion, severity of the condition, and the level of how you can use it, how it impairs you, and the causes of it.
Yeah. And then another one is one of my favorite ones, because that's what I have. Okay, that's my biggest injury is my back conditions. The VA rates various back conditions, including herniated discs, degenerative disc disease, like one of our fellow veterans here has, the spinal stenosis, which I actually just got discovered with that. And the VA will consider the range of motion, the level of pain, and how much you can utilize the body part, and if you need surgery. Okay, so they consider all those things for when it comes to rating.
Yeah, and if you need surgery to remove the body part, then we're talking about amputations. So the VA rates amputations based on, like that little slide I did there, VA rates the amputations based on the degree and level of the functional impairment following the surgery. And that could include losing a limb, finger, or a toe. And if they took off your whole right arm, probably 100%. But they have different conditions that they'll rate you for based on that.
Yep. Another one is fractures and dislocations that you may have suffered while on active duty. Okay. The VA rates the fractures and dislocations based on the location of the injury, its severity, and the level of functional impairment. Okay. And that's pretty much with any condition. That's the way the rate that the VA utilizes the rating criteria.
Yeah, and then we have the soft tissue injury. So the VA rates the soft tissue injuries like strains, sprains, contusions based on the severity of the injury and the level and functional of the impairment. And we say that a lot with musculoskeletal conditions. And the need for continuous treatment and rehab, continuity of care.
Yep. Shin splints. This is very common, especially at the beginning when you're going to boot camp, all that running, shuffling, everything, exercises, So the VA, once again, the VA rates based on the conservative treatment, limited weight bearing ability, the muscle dislocation, overall function impairment, and the pain range of motion. So.
Yeah. So, and then we have osteomyelitis. That's osteomyelitis. That is an inflammation of the bone, and it's an infection of the bone marrow. And yeah, man, it's pretty nasty. It's very painful too. And the VA will rate that depending on the ranging of the acute, subacute, or chronic. For example, if a veteran has an inactive case or without any evidence of an active case within the last 5 years, they'll probably receive the lowest rating.
Yeah. Okay. Hey, another common one, ankle tendonitis. Okay, so a lot of people, they just twist their ankle, they sprain their ankle while in active duty. The VA, mainly, it depends on the level of plantar flexion and mobility of the ankle.
Yeah, and then bursitis. So bursitis is another one. That's the VA rates that on the level of mobility of the affected extremity, for example. So bursitis. That's just an inflammation of the bursa around your knees, elbows, and shoulders. And the VA will rate that by just how well you can move it, what the degree of the movement can be, how hard you can move it up to the side. But that's how they rate that.
Do you have that? Since you have it,
I do. I have it of my right shoulder.
Okay.
Yeah, I landed on it. They blew it out pretty good. So I got a lot of issues with my shoulder. I do have bursitis. So.
Another one, which is I heard is very painful. It's actually the gout, which is a form of arthritis, and the VA rates it based. It's in the same category as arthritis. So it's based on the severity and the number of yearly flare-ups. So that's where it's very important, understanding each condition. It's like, hey, how often does it flare up? You have complications, okay? And not only that, when you have the flare-ups, how does it affect your life? What kind of things you can or cannot do?
Yeah, it's nasty. So then we have decompression sickness. Now, decompression sickness, the VA rates decompression, what that is, that's just the gas bubbles or the nitrogen that will form in your body. And that could be from diving, coming up too quickly, or if the reason I never got dive certified was because flying, I couldn't balance the flight time with the time that I'd have been in the water. And that can also happen. So you can get the flying after diving, you can get the decompression sickness as well. Yeah, and they'll hit that up with the appropriate diagnostic code for the affected body system for that. Yeah, it's nasty, man. I know that is.
Yeah. Tuberculosis of the joints and bones. Okay, this was something I did not realize, meaning that you can get tuberculosis in those like that way. Okay, this is just tuberculosis of the joints and bones based on whether it is active or inactive. So that's how the VA rates it. Okay, now let's talk about what could have caused what kind of things could have caused these musculoskeletal conditions. Okay, several issues occur regularly while in service. Obviously, that can lead to these conditions to come up. Okay, accidents. That's how mine came up with my back. I actually was coming down a parachute jump, and right before I landed, the wind blew, which made me go horizontal, and I landed right on my back. So adrenaline was kicking, so I felt it, but I felt it more when I got to the barracks. Okay, overuse of specific body parts. Hey, a lot of my shoulders hurt because of all the push-ups and the pulls that I had to do while in active duty. Strenuous physical training. Of course, it makes sense, right? Carrying heavy equipment and a lot of times carrying it improperly, okay, and repetitive motions. Okay, all these things and more can contribute for you to experience these musculoskeletal conditions. And then, obviously, over time, these issues can lead to severe medical conditions requiring the VA, requiring VA musculoskeletal benefits and compensation. And like I said before, most common ones are like back pain, tendonitis, shin splints, plantar fasciitis, that can be caused by daily exercise and activities.
Yeah, those things you don't. It could be while you serve, you deserve. You have things happen to you. I blew my shoulder out playing softball, so and people get shin splints and things just swimming on the swimming side of the house are doing that. So it doesn't necessarily have to be combat related or while you're out there. If you're on active duty and you have things that happen to you, yep, that's a reason for it.
That is a great point. Things happen. Things can happen when you are on leave or on active duty. Okay, so yeah. So if you had any of these events happen to you, just looking, that's a good way for you to approach this process.
So the big thing is you have these things happen. You want to get a diagnosis and a treatment for the musculoskeletal conditions. So veterans are going to undergo testing to determine the cause of their musculoskeletal condition before the treatment can even begin. So here's just a few of the common types of testing that you can experience. So you'll have x-rays, you can have blood tests, CT scans, have the MRIs, where you get put in that machine. And once your condition's been diagnosed, you'll begin your treatment. Since musculoskeletal disorders vary in their severity, so will your treatment plan. So your doctor may recommend the following depending on your current diagnosis: pain relievers, physical therapy, therapeutic massages, acupuncture. Acupuncture is relatively new. I think that's probably within 20 years for sure. Steroid injections, occupational therapy. And then they have several methods to relieve the pain while you're recovering at home. So that would be like hot and cold therapy. So that could be ice packs, the heating pads. I think we've all been through those. Stretching. If you receive physical therapy, your therapist will recommend the appropriate stretches. Like for shoulders, they have the armband things that you did. I hated those. Conditioning and strengthening. Motion is lotion for sure with everything we do. But over-the-counter pain reliever medications and stress reducer techniques. It could be like yoga. I say yoga for golf. But you should always seek your professional medical advice if you're not receiving relief from your treatment plan, for sure.
Yep. And that's one thing. Another thing, you need to, if you're not going to your doctor, or if you don't have a doctor, or if you've been, you haven't been treating yourself for these conditions, you need to get there. Okay. Not only for you to feel better, but then if you need that medical evidence to support the claim, that's how you develop it. Okay. So yeah. Where you're not in the military anymore, you don't have to tough it out. You don't have to do this by yourself, okay? Because then this is how you can probably, qualify to receive the VA VA benefits for musculoskeletal conditions. Veterans with one or more listed conditions may be eligible for the musculoskeletal VA rating, including the appropriate VA benefits and compensation. Veterans must have a service-connected injury or illness and are rated at least 10% for the VA to be of the VA to be eligible for disability compensation. Okay. Some musculoskeletal system disease become permanent because they are incurable. Okay, like degenerate arthritis. However, you only qualify for permanent and total status if you receive a VA rating of 100%. So you have to have the 100% permanent percentage first to then be able to qualify for that golden permanent total, or PNT as we most commonly refer to it here.
Yeah. So the required proof for VA benefits for musculoskeletal conditions You got to provide the following when you submit a claim to prove your disability: a diagnosis of a current disability in a medical record, evidence of an in-service event, injury, disease, or aggravation, and then a nexus, meaning that's a link that's going to connect the two via competent medical evidence. Nexus
That's very
letters and
important.
claims.
Yep. And if you look at your decision letters, you will see that those things are listed, why they did or did not approve the condition. Okay. Now,
Yeah,
one of the things that you could go ahead. No,
no,
go ahead.
I was just going to say, so your decision letters are going to be like a kind of like a roadmap. Tells you why you won, why you were denied. It gives you the outlines for that. It kind of helps piece that together. Very important to review your decision letters. Sorry.
Mm-hmm. No, good. I did that before. I'll just see if it was denied or approved, or if it was denied, I'll just throw it away. Okay. But no, we look at it. We look at it. That's part of the strategy, like Coach Walter was referring to earlier. Okay. Now, there's some benefits that you might be eligible once you have these, conditions that are service connected. Just like the Veteran Readiness and Employment Service. That's the VRNE. The Veterans Readiness and Employment Services are available to disabled veterans. These services they're designed to help veterans with service-connected conditions to prepare, find, or maintain employment, including job training, career counseling, and assistance with job placement. The VA also provides benefits to veterans with conditions that have affected their ability to work, including a pension for veterans who are permanently disabled as a result of their military service. Okay. In addition, the VA offers a program called Total Disability based on individual unemployability, also known as TDIU. This allows the veterans who can't work due to the service-connected conditions to receive the same compensation as a veteran rated at 100%, even though the combination of their rating does not add to 100%. Okay. Additionally, benefits may include home modifications, respite care. Respite care is when there's a program to alleviate the burden, not the burden, but to alleviate the family members that are taking care of the veteran, to have people come in and pretty much just relieve the family members to take care of the veteran. Okay, which is a very good program. Financial assistance, healthcare services, vocational rehab, and adapted equipment.
All right. Now, let's talk a little bit about how the VA rates your musculoskeletal conditions. Man, that word. Musculoskeletal conditions are one of the most straightforward VA in the claims disability. I mean, because you got it or you don't. So they're commonly rated at 10, 20, and 20, 0 to 10 to 20%. A lot of times they can range from 0 to 100%, depending on the severity of the level of impairment. So the Veteran Affairs Schedule of Ratings, Veteran VASRD, occasionally uses the terms like incapacitating, unless specifically noted. There's no clear-cut definition for terms like this, so the rating authorities must decide precisely what it means in each case. In general, rule for defining incapacitating is whether or not the condition makes it impossible for the service member to do their job or function well in daily life. Whether you can do it or you can't. If it does, it would be most likely be considered incapacitating. So veterans with musculoskeletal conditions directly linked to their time in the service are eligible for musculoskeletal VA ratings. Kind of makes sense, along with the appropriate VA benefits and compensation that goes along with it. It's incapacitating. All right, Jaime.
Yeah. No. So these are just we just bring it up. This is just one of the topics that you bring up. Now we're going to open up to Q&As. So feel free in the chat to present your question. That way we can refer to it. We can bring it up, talk about it. We'll do our best to answer it. And like I said at the beginning, if we don't get to your answer, we don't respond to by the time that this presentation is over. Just come back. Our team will gladly, answer it at a later time and have the answer for you. Okay. Do you see any of these that are in here?
I'm looking.
Yeah.
Might have to put my glasses on.
Okay. Now I got Alan, right? Alan Stafford saw a sick call for my back in the 70s, but VA says because I didn't follow up, they denied my claim. Now I have back, knee, hip, and sciatic. Okay, well, that makes sense. Okay, makes sense that you have all these conditions because it's kind of like snowballs. Okay, you've been walking differently all these years. Okay, so now your gait is different. There where your body mechanics are different, causing these other conditions that pop up. What the VA says, why they denied it, if you injured yourself the back in your situation, Alan, you went to sick call even once or medical. We call it sick call in the Army. Okay, but then you got out of the military and you haven't showed that the condition has been bothering you still. So that's why they denied it. They probably admit that they do see that in the letter, that they see that there is an injury, an event that happened in 1970. Okay. But because of that, they denied it. So what you need to do is just show that the condition has continued to bother you, get some new evidence, some medical evidence, get treatment, just like we've been discussed earlier, to show that you are still suffering from it, and then you can go back and look for it, correction, and apply for it, okay, with proper evidence and strategy, and make sure that you understand how to talk about that during your CMP examination. Now, the other things can probably be connected secondary to the back, like the hip, the sciatic, because it's natural. Okay, so once you connect one, then you can connect the other ones with as a secondary. Okay, and that's where you're might need a nexus letter. Okay, and nexus letter is a document by an opinion from a doctor, where peer-reviewed studies, treatment information, case laws, with that opinion saying that the most likely reason why you are suffering from this new condition is because of that condition that was related to the military. Okay, so and by the way, correction, just because you got denied a claim does not mean that you cannot fight it again. Okay, but now you need to fight it with the proper knowledge. Okay, the proper strategy and the proper evidence.
Yep. So Joe Seibert, my knees have moderate osteoarthritis, cartilage loss, was told, yep, caused by the Army, awarded 0%. Well, got awarded 0%. So probably just severity. You've got to get your tail to the doctor. We say that all the time. If it's gotten worse, get it checked out. But the big thing is it's frustrating, because it gets recognized. But if your conditions aren't getting bad, you got to get it checked out. So you get to the doctor, get the diagnosis, show a continuity of care. If it's getting worse, then go ahead and get it checked out, file a claim. Yeah, but it's just they're probably rewarding it at 0% because they're just not showing any level of pain or anything.
Mm-hmm. But one thing that I'm glad that this came up, because a lot of people don't realize that a 0% means that it is connected. Mm-hmm. Okay, it's just not compensable. Okay, your job, is to show that the condition has gotten worse and that it should merit a higher rating. Okay, so this is very important. Thank you, Joe, for that information.
And again, you'd have the X-rays. You can have the X-rays to back that up, right? X-rays or MRIs. Mm-hmm. And they'll do that. So you get that. Just get to the doctor, if it's getting worse. And you could have other conditions like you were talking about. If it's your knees, messes up your gait, could affect your back. Could be something else going on too.
Mm-hmm. So, and with that said, when you go to a doctor, okay, any doctor, doesn't matter if it's VA or your private doctor, do not minimize your symptoms. Okay, do not do that, because what you're doing, you're just hurting yourself. Okay, you need to let the doctor know. This is with anything, how the condition is, what are the symptoms that you are experiencing, and how does that affect you. That way, they can treat you properly. Okay, and then what you're doing is, in the background, all you're doing is accumulating evidence to support the claim later on. So don't do yourself a favor and make sure that you are honest. Okay, do not hold back.
Well, especially with that, a lot of veterans don't want to be disabled veterans. You know, they're holding out, right? And you got to be honest, like you say, you got to be brutally honest, be true to yourself for your VA benefits. Because what you don't tell them, they don't know when you're talking about these things. And it's no shame at all to be a disabled vet and have to go and get compensated. Right.
Hey, one of the things that our boss says here, other than, get your butt to your doctor, is if you served, you deserve. Okay. You signed up, you rose your hand, okay, and you swear that oath. So you need to be compensated properly, okay, based on what's going on with you. I have a good one here, okay. Jakin Flanagan, hope I pronounced his first name right. Jakin Flanagan. He has a CMP this Saturday for the back and sciatic, okay. Jason, don't do what I did when I went for my increase in my back, okay. When I went for my increase from my back, the evaluator went in there. He said, bend forward and touch your toes. Oh, as a good Army soldier, that's what I did. Even though I was hurting, okay. Now, when you go into your CMP examination, first of all, you need to understand, just like we've been saying here, you need to talk about the condition, right? If it, how did it happen? We're going to talk about it. How did it happen? It happened on active duty, or is it secondary? Whatever the case is, okay. And then go into the symptoms. What's been going on with your back? Okay, how many flare-ups do you have a month or a year? And are those flare-ups hindering you from working properly? You have to take off time. All these things. All right, and then you go into the pain level. And that day could be a good day. All right. But so you're not going to overreact. You're just going to be yourself. But if tomorrow and Saturday is a good day compared to other days, then you're going to talk about the worst days. Okay. And then when it comes to the range of motion, when they have you do the exercises, this is very important. This is where you're not going to just do it just because. You're going to stop when you start feeling pain and or discomfort. Okay. And they're supposed to utilize an instrument called the goniometer, which if you have done any type of therapy, physical therapy, you've seen it. It's like a circle with it's a plastic ruler that opens and closes to measure angles. They're supposed to use that to make sure that they can properly measure your range of motion. That's why you have to stop whenever you start feeling pain or discomfort. Okay, so I hope that helped you. And good luck. And I hope this actually gave information to everybody else here too. Anybody else?
All right, Jose Garcia. I have issues that are bothering me now that I never went to the medical for when I served, but over the years my body's gotten worse. Would the VA consider these? Get to the doctor, get a diagnosis of your current conditions that are going on. And, we talk about strategy, education, medical evidence. So you had your in-service event or injury. You have to have that diagnosis first. And so get your diagnoses, and then once you have a diagnosis, you could file a claim through VA. But the VA will consider, you got to have a diagnosis before you can do anything. A diagnosis, in-service event or injury, and then medical evidence to back that claim up. And you can do that through your private doctor, or if you have somebody who can do that for you. But yeah, don't give up. You serve, you deserve. Had things happen to you while you were in, definitely get to the doctor, get a diagnosis. First thing starts with a diagnosis and a treatment plan. Continuity of care. Show you're trying to get better.
Okay. I have one. This is a very unique one. This is from John Shetek. I have a severe RLS. That's actually restless leg syndrome. Problem is, medical community does not know what causes it. I do have VA connected severe sleep apnea and tinnitus, both at which doctors say are likely as not connected to RS. VA sent me to a CMP. The CMP concurred, and then the decision was denied because they couldn't find the connection to service. Yeah. Okay. So one of the first things you need to understand is that's a neurological condition, if I'm mistaken. Okay. So it has to do with the nerves, right? You need to understand what can cause. So do the research that what can cause the RLS. Okay. And then if you have one of the conditions that can cause that RLS, then you might have to connect that condition first, okay, as a primary, to then blame medically the RLS, the restless leg syndrome, to that condition, okay? A common one is mental health. Mental health can cause that, okay? I have actually, I picked this one because I had a veteran that I work with who, believe it or not, actually on Monday reached 100%. But one of his biggest wins was RRS, and that's how we connected it. So if you want, book a discovery call with one of us, either Coach Walter or myself or any of our veteran coaches, and see if we can, help you in that journey. Is there anything else?
Looking.
Oh, let me answer this one. Jacob Flanagan. So no, I did not drop out of airborne school. I actually was. I completed my airborne school in Fort Benning, Georgia, in '94. It was in a jump in Fort Bragg when I was stationed on Sicily drop zone. So no, I after that back injury, I recovered and I continued to jump until I got out of active duty. So, but thank you for that. And Lowell Codwell. Hua, red leg, he was also artillery. So good for you, red leg, gun bunny, as we call ourselves.
Sure, y'all got some tinnitus going on.
Any other ones that you want to discuss?
Oh, I see. Well, Mike Smith, you're asking how you can prove gum disease happened while you were in a combat zone. Buddy letters. It's not buddy letters aren't medical evidence, but buddy letters. If you have any documentation that can point the gum disease while you were out there in service. I don't know, Jaime. What do you think about that one?
Yeah, I mean, did it start? Did you go to the dentist in combat zone? And I say this because I was in the combat zone. Excuse me, I was in Afghanistan. I was at Camp Phoenix, and then we did have a dental office. But did you go to the dental facility clinic to get treatment for it? Okay, because if it's in your medical records, then that's your door open. Okay, so all you need to do is, just like we discussed before, if it happened in active duty, if it's in your medical records, now it's time for you to demonstrate that you still are experiencing the condition, okay, that's bothering you, and then you can attack it that way, okay? But one thing, and this is true with everybody, if the condition that you're trying to pursue is not in your medical records, okay, you never went to sicko for it, you never reported it, you never complained about it, the VA sees it as never happened, okay? So it will be on you to try to demonstrate that it happened, that it occurred, that you suffered from it, okay? And yeah, buddy letters can happen. Pictures, believe it or not, can happen, okay? Anything. Just, you have to think outside the box, okay? But then again, you have to think about this. That's where the strategy comes in, right, Walter? The gum disease might be something that it's only like a 10%. Okay. So you don't want to dedicate your time and effort on something that can only get you 10%. That might not even increase your overall rating. Okay. Now, can you put that together with something that is big? Yes, it makes sense. Okay. That's why we are here. Okay. We try to educate you with the proper strategy, the process, the medical evidence to guide you to be successful through this process.
Wow.
So I got another one here. This is a good one. Curtis Haney, hope I pronounced that right. Navy veteran, one of your buddies there, had a foot crushed by a steel door, went to the base hospital for 3 months, physical therapy, and told condition would worsen with age. Makes sense. Now walk with the foot brace paid by the VA, but not rewarded with claim. Hey, Curtis, you spent that time 3 months in the hospital, did physical therapy, then you have good chances of applying for it. Okay, I would love to help you. Walter probably would love to help you too if you want to go with the Navy guy here too. Let us help you. You have the medical evidence, even if you don't have the medical records yourself, but you know it happened. You know it should be in medical records. So now, once again, you have to show that the condition is still bothering you. Okay, they're still affecting you, and you've been given a brace by the VA. That's evidence that it's still bothering you. Okay, so hey, get on board with us. We'll love to help you. All right, Walter?
Yeah, keep going to the doctor. Keep going to the doctor. That's a hard one for a lot of us. You know, we didn't go to the doctor when we're in, or don't go to the doctor when we're out. I can attest to that too. Yeah, go to the doctor, show the continuity of care, show you're trying to get better, and if you have other things come up, get your diagnoses.
That's pretty much the same thing with Chantel Smith in 7915. Okay. I had a truck roll over twice. Okay, so that's 2 times that she had a rollover. Okay, I have it on my medical records, which right there, good. Okay, it happened. It's in her medical records, but not the rollover in Iraq. I was denied for back. What should I do? So you had the rollover once at least, right? The one is documented. Okay. So again, just like we told Curtis, okay, just because it got denied does not mean that it cannot be attacked again, right? So make sure that you have new evidence to show, okay, that you are still suffering from the back condition, all right, and then make sure you present that. You know, that's the connection. Make sure you have to show the connection. This happened in active duty when I had the first rollover, okay, or whichever one is that is recorded. Anything else that you might want to add to that, Coach?
No, I mean, you still might have to have a nexus, you know, to tie it in. Still have that getting in there. No, I mean twice. Holy cow!
Mm-hmm.
That's a lot. Once is enough.
Yeah. So, hey, we have about 11 more minutes to go. Okay. Please, take advantage of us here. Okay. We love doing this. Okay. We do this for a living. Okay. I don't know about you, Coach Walter, but I look at a person, a veteran, and I'm tempted always to go to them and say, hey, how you doing? What's your status? Okay.
Yeah. I know. I like talking. I like talking.
Yeah.
And that's why I like going to the VA. I like going to the VA and talking to the vets when I'm there. It's never a boring time. Seeing what's going on, and that's good to see the veterans at the VA because they're working on them.
Okay. This is you see the one that Lisa Brooks, Mo? You want to get that one?
Let me see. GERD can be connected to sleep apnea or back. Maybe. I don't believe so.
Well, it can be indirectly. It could be,
for medication,
for example,
right?
yeah,
Secondary.
medication. Yeah, yeah,
Yep, secondary to
yeah.
that.
So you can get medication, for example, the back. Okay, you might be because of back injury that is service connected. Okay, you've been prescribed medicine throughout the years that has caused you to get GERD. And for those who do not know what GERD is, that's gastroesophageal reflux disease. That's pretty much a heartburn. That's a reflux. Okay. Um, so yeah, it can be that. Now, GERD can be the cause for your sleep apnea. Okay. So, so it's not GERD caused by sleep apnea, but sleep apnea can be like sleep apnea cannot cause the GERD, but the GERD can cause a sleep apnea. Why? Because your regurgitation, especially when you're laying down while you're sleeping, is affecting your esophagus. Therefore, you're not breathing properly. Okay. But there could be a connection with back and medication. Okay, Lisa. So I hope that give you some information there. But also Lisa, the one that I was referring to, is she said, "How do I get copies of my past CMP examinations?" Okay, so in order for you to do that, you will have to request it to the VA. Okay, and by doing so, you have to request your C file, your compensation file. Okay, and when you request a C file, everything that you have done at the VA will be there. And to be honest, whatever they found, whatever records they found, especially when you first submit a claim, the first thing they have to do is look for your medical records. So you will get those medical records, plus every single documentation related to your claims. Okay. Now, if you go into our blogs, if you go to vaclaimsinsider.com, and we're in the top right where it says top middle where it says for our veterans, just going to be hover over that, and you'll see our blog. Go ahead and type in C file. Okay, and if you type in C file as in Charlie, C file, you'll see the articles that we have that can guide you through this process, Lisa, and that's for everybody else. Okay, one thing to understand, it's going to take a while. Okay, because actually what you're doing, you're doing a FOIA request, a Freedom of Information request. So it's going to take a while. And in order for you to receive your complete C file, everything has to be redacted. There's things that have to be redacted because information of personnel. Okay, so it's going to take a while. When I did mine, it took me 5 months for me to receive my C file. Okay. This is a Jake and Flanagan again. Okay. I filled out my own DBQ. I was denied already, and the CMP only lasted 15 minutes. Okay. I don't know what was the DBQ for. And for those who do not know, DBQ is a disability benefits questionnaire. Actually, that is a VA form. It's the VA form that gets filled out by the CMP examiner every time you go into the evaluation. And it all depends on, it varies depending on what kind of condition it is. Okay. There's a series of testing questions that need to be answered. Okay. Jacob, first of all, it needs to be filled out by a doctor. So if you're not a doctor, is not valid. Okay. Now you can introduce a DBQ from an outside doctor, but it has to be a certified doctor. Okay. Now the CMP lasting only 15 minutes. That all depends on the situation. So, without knowing more information, I cannot provide you a proper idea of strategy. Hey, maybe after your CMP, after the CMP, and after the results from this last claim that you submitted, if you still need help, why not reach out to either Walter or myself and see if we can, help you the last stretch. Okay. Hey, we have 5 minutes, Coach.
All right.
Let's say one more before we wrap it up.
All right.
And remember, if we did not get to you, later on today, come back to the presentation. It's going to be pre-recorded. It's going to be in our Facebook site. Okay. You got one more? Got one more there, Coach?
Yeah, I'm looking. All right. What do we got? Okay. Cover that.
I can do it. Right. What about that William Copcia at William? I have been waiting since June 2023 for a hearing with the VA judge for a back claim. Okay. I'm not sure if you mean a lower back claim or a back pay claim, which with much evidence. How long is the wait to see a judge? Okay. I really don't know the complete answer. What I know is when you send a claim to the Board of Appeals, that's the longest wait time. And as of right now, what we know is 5 to 7 years wait time. Okay. So with that said, it all depends if you want to continue or if you want to, do something else. My recommendation is that, while you're waiting on that, just work on something else that can be attainable. Okay. All right, folks. So with that said, we have 3 minutes left. Okay. Just to recap what we discussed related to the musculoskeletal conditions. Okay. There are numerous conditions that can be rated by the VA. Okay. So knowing which ones they are, how they get rated, how do they manifest on you? What kind of evidence you need, and what you need to do is very important. Okay. You need to understand how did it cause? How did it start? Did it start because of injuries, accidents that happened in active duty? You went to sick call, or is after the fact is secondary to some, there's something that you already have service connected. Okay. Remember, when going through this process, you have to have the diagnosis of the condition. You have to show treatment for it, okay, in order for you to be more successful at, for your claims. And then ultimately, like I said, when it comes to that CMP examination, once you submit it, you understand, how it gets rated, and, how to explain it. That way you can capitalize on your CMP examination. All right. And the recap with us here at VA Claims Insider, we focus on strategy, education, and medical evidence through this entire process. Okay, that's been working because our boss, Brian Reese, he realized, hey, this is the pathway that is the easiest, not the easiest, but is the best way to approach this process. Okay, we do that with one-on-one coaching. Where we, come up with, based on your situation, your evidence, what you have, the strategy. We educate you on how to submit the claim properly. And then we educate you on preparing for the CMP examination. Okay. That way you're more successful. What else do we have?
We got the live classes via Teams, VACI1. And we have up to 3 live classes. We have the Coffee with the Coaches. I recommend that. That's Monday, Wednesday, and Friday mornings, not on holidays. And then we have the mental health education exam or mental health exam education classes, and also the medical exam education classes. They get you ready so that you know your conditions and how to speak about it. And then also we have Brian's new book, VA Claim Secrets. It's now available. Order yours on Amazon today. And for discovery calls, if you want to learn more, schedule a discovery call and talk to one of our team members by going to vaclaimsinsider.com. And reach out to our organization at vaclaimsinsider.com. We'd love to partner with you on your VA claims journey and get you going. Yeah. Have a good time.
Thank you, everyone. Thank you for being here. Thank you for your service. Good luck on everything. Godspeed, and have a good day.
On purpose.